Thank you, Victor, for giving us your testimony. For my YouTube followers, I think it's so important for people to hear about how programs work, the ups and the downs of it. So thank you very much.
You're welcome, Dr. A, and it's my pleasure.
Okay, Victor, it's been about 6 weeks since you first started the diabetes reversal program.
Yes, yes, it is.
How has it been going?
Well, it's been good so far. In fact, I thought it would have been worse, having thought about all that good food that I used to have, and I was wondering if I was going to be in a torture. But it was good. I liked the food. It was very tasty. I got to do what I wanted to do. I got to do my exercise and everything. So it was great. It was great.
Okay.
It's a good experience so far. I must say though, sometimes it's been tough,
Yes.
right? So you got to make sacrifices, but it was really good on the whole.
Okay.
Yes.
All right. Good, good, good. So let's get into some of the details so people really can get a feel for the advantages and the hurdles a bit.
Yes.
Um, can you give us some history about your diabetes journey? Just like how long you've had diabetes and how many medications you've been taking, and
Okay.
did you have some success in the program getting off some of those meds?
Well, yeah, I've been on diabetes now. I'm sure it's over 15 years.
15?
15, one
Okay.
five.
Uh-huh. Okay.
I remember back in the days when the doctors were telling me you're pre-diabetic, you got to be watching your intake, your food, etc. You got to exercise. Well, really and truly, exercise was never really a problem for me because I'm always exercising to a great extent, involved in sports, tennis, and pickleball and all that good stuff. But my biggest problem, I think, was the food. You know,
Mm. You love food, huh?
food. Yeah, they call me a foodie. I don't know if you
Oh,
know
okay.
that, but
Oh,
yeah, yes,
okay.
I love food. Food, I love to eat. You can
Uh-huh.
see it shows on me.
Let me see, let me see, let me see. No, no, no.
Yes, yes,
You don't look fat at
yes,
all.
yes, yes.
So,
But uh, it's been a long time. Sometimes I know different. I've been on different programs, and
mm,
some have been successful for a short while.
mm,
But in the long run, you tend to go back in your bad
mm-hmm,
habits and so on. And so
mm-hmm,
um, I really looked forward for this because I'm reaching a stage in my life, I believe, when I'm not so young again, and I need to correct things before they get worse. And I've seen some of my friends, some of my relatives, some of my associates who have had really not so good experiences, kidney failures, and some of them even pass on
mm.
as a result of diabetes. So
So,
I think it's time that I take a hold of my situation and work on a program that could bring me good results. And if I can reverse it, then that would be ultimate. That would
mm-hmm,
be great. Yes.
mm-hmm. Okay. Um, your blood sugars before you started the program, can you say about what do you remember the highs and lows to be? And then with the program, did you see improvement in your blood sugars? Like what was the ranges? What did you
Right.
see it, what was the pattern for you?
Oh, well, before I started, I think I remember. Well, I did just before I came from the states, before we came here. Um, I think the doctor said my A1C was like 8.6. I think it was.
Mm,
The blood sugars were high. Sometimes I have real high highs, like in the 300, 400. Not too often, to be honest with you. Mostly 300. Uh, the lows were very few. If I, probably take medication and didn't eat. Talk about medication, I was on a whole lot of them. I think I was on about 5 different diabetes tablets, right?
mm-hmm, mm-hmm,
Well, tablets plus insulin,
mm-hmm, mm-hmm,
right? So I was on quite a bit. I think the doctors might have maxed out what I could get. So yeah, I was struggling a lot with it. I had some good days, very few ones, but there were some long bad days, you know, where the sugar was pretty high, and I get up in the morning, it would be like 150s, sometimes 160s. Really, when I see a 130, I'll be happy, you know, 120.
Mhm. Mm.
120 will be a real good day.
Mhm.
So it was a struggle, it was a fight. I tried to follow the plans that the doctor told me. I tried to take the but I take out the medications on, you know, schedule as was scheduled. But I think the food was my biggest problem. Food was
Mhm.
my biggest problem.
You mean the dumplings, man?
Dumplings, fried dumplings, cooked dumplings, rice, you know, the cakes,
Avocado,
the
like all the avocado
avocados,
you could
the
eat, you were
nuts and
eating
all the
that.
greens and all the nuts and, you know,
What did you
and
learn? What did you learn about avocado?
where did I learn to eat it?
What did you learn about avocado?
Oh, you mean in the program? Oh,
Yeah.
I learned that avocado is good for you, but you got to use it within limits because it is still, it still has its fats. It's all you know, plants still have their fats, and you got to be careful. Some can be healthy, some can be not so healthy.
Mhm.
So avocados, I've learned now not to eat a whole one or two. You know, you
Mm.
just cut it down. And in fact, the Bible said everything should be done in moderation. And
Mhm.
if we do it in moderation, I think we're great. We'll be
Mhm.
good.
That's a good point.
Yeah,
Good
yeah.
point. Good point.
So I still love avocados, but I love to eat it, you know, within limits.
Right, right.
Yes.
Okay. So you said like your hemoglobin A1C was like
Six.
8.6
I think it's about
before.
8.6, right?
And do you remember what it is about now or recently?
Well, this is not official really because it's from the machine, the G7 monitor I'm wearing.
Mm-hmm.
But this morning it was 7.3.
Mm-hmm.
In fact, last week it was even better. I got bad sort of week. Last week it dropped to 6.8, I think it
Mm-hmm.
was.
Mm-hmm.
Right, but now it's like 7.3, which is a whole lot better than it was.
Right.
Um,
Mm-hmm.
and I'm feeling a whole lot better within myself. You know,
Okay.
as
Okay.
a much lighter, much
Mm.
more energetic.
Mm-hmm.
You know, so it's been great so far. It's been great.
Okay. Okay. What else would you say you've learned? Some things, that diabetics need to know. That
Oh,
may be,
okay.
yeah.
Yeah. I have learned. In fact, I was what you could call a pescatarian before I came here.
Mm.
I haven't had red meat or meat per se for a very long time, but I still used to do fish. I used to cook with a lot of oils and fats and the nice tasting thing. So what have I learned? I learned that one, if I can totally go plant based, it will be very beneficial. That's the first thing.
Mm-hmm.
I'm going to try and keep as plant based as possible. Leave out all animal products, no milk, no cheese, and all that good stuff.
Mm-hmm.
Um, then also meal times. I used to eat two, mainly two meals, but then I would be snacking, and nuts and so on. I've been here. I haven't snacked on nuts
Mm.
or snack.
Mm-hmm.
So I'm gonna well, continue the two meal time, one in the morning,
Mm-hmm.
and last meal should be about latest 2 to 3 o'clock in the evening. So I have a long fasting period for next morning.
Mm-hmm.
So that I've learned
Mm-hmm.
also, and taking in water. Make sure you get your adequate amount of water.
Mm-hmm.
Make sure you get rest. That was one of my biggest
Okay.
problems.
Yeah. Yeah.
Yeah, my biggest problem, I think, is to sleep through a whole night, right?
Yeah. Yeah.
I'm still working on that one.
Yes. Yes.
I'm still working on that one. Because throughout my life, I've been running on 4 hours of sleep at night, and if I get a nap in the day, it's fine.
Mm.
But now I'm on research, and with your input, I understand that I need adequate 7 to 8 hours of rest each night.
Right.
Yes, I hope
Right.
I can get that. So that is a biggie for me.
Mm-hmm.
Rest. Um, Leave out all animal fats,
Mm-hmm.
on animal products.
Mm-hmm.
Even the nuts and grains. Be very moderate on them. Like I said, the avocados,
Mm-hmm.
the plant-based fats are still can be still dangerous if it's taken in too much of great proportion.
Mm-hmm.
You do get a balanced diet, and this includes your protein, your carbo, your nuts, your grains. Just like the Bible said, your vegetables, a lot of veggies, and I've been eating a lot of veggies. That's really, really good. So for diabetes, and by the way, to say, if you ask me about other people who have diabetes
Mm-hmm.
or other diabetics, what I would say to them, listen, and I read this too. What I would suggest is just go into it and try it. When you stop and you think about it, it seems as if it's difficult to do. But as I was reading, what's his name, Barnard, Dr. Barnard's book.
Mm-hmm.
He said, if you can do 21 days, just don't think of a month, don't think of a year.
Mm-hmm.
Start off with 21 days
Mm-hmm.
on the program,
Mm-hmm.
and what you find that even your taste buds change within that period, right?
Mm-hmm.
But and if you prepare plant-based food properly, as we
Mm-hmm.
have been doing, it tastes as good or better than meat, right?
Mm.
So
Wonderful.
it's not that you're going to lose taste. It's a different taste, I must say,
Right.
but it's a healthy, refreshing
Right.
taste.
Right.
So
Right.
I still enjoy my food. I'm still a foodie, but
Mm-hmm.
it's just I'm eating different things at
Mm-hmm.
different times in
Mm-hmm.
different proportions, and
Mm-hmm.
that is what's important. So what do I say to other diabetics? You can do it.
Mm.
It's possible. You
Yeah.
just got to make up your mind and just start with day one. Don't think of 3 months down the road. Think of the first day, the
Mm-hmm.
second day, down to the 21st day.
Right. Right.
And after
And
that, you're going to find that you don't even remember how meat tastes. You don't remember how cow's milk tastes. You don't remember how animal flesh in general tastes.
mm-hmm.
And you'll be healthier, and you will lose weight. You
Mm-hmm.
will also have more energy,
Mm-hmm.
and
Mm-hmm.
your sugar levels will go down.
Right. And
Yeah,
just
will go down.
feeling better overall,
Yeah,
even
your
in taking
overall
care of
feeling is
yourself.
better. Yes, it's better.
Yeah.
Mine is better.
Yeah.
Right.
Yeah. Yeah. Wonderful. Wonderful.
Doc, you asked me a question earlier on about what I would recommend to other diabetics.
Mm, mm,
Yeah, I just remember another thing I learned in the program is foods that have what they call high glycemic index
mm-hmm,
and low glycemic index. So you can be eating
mm,
plant-based food, I'm learned,
mm,
but you have to choose very well the ones you eat, because if you eat if you eat foods with high glycemic index, it tends to raise your sugar levels too,
mm-hmm,
right? So we need to seek out foods that have low glycemic index, and that can be found easily as you read about these foods that you're eating.
mm-hmm.
Also,
Like berries are.
well, yeah, like examples like berries, all
Mm-hmm,
berries are good, low glycemic index, right?
mm-hmm, mm-hmm. And
And
bananas, ripe bananas.
ripe banana is my favorite, but I have
Mm,
to leave that out because that's high glycemic,
and
right?
it
Yes.
shoots your blood
Yeah,
sugar
it
up.
shoots the blood sugar up. And yeah,
Right.
one of the problems with the high glycemic foods
Mm-hmm,
I learned is
mm-hmm.
that it shoots your blood sugar levels up real fast.
Yeah.
And you don't want those big fluctuations, very high, very
Right.
low
Right.
suddenly.
Yeah.
You want more, the leveler you get it, your
Mm-hmm,
graph,
mm-hmm,
I think it's the better for you. I'm learning
mm-hmm,
all that now,
mm-hmm, mm-hmm.
right? Like you need to eat your nuts, you need to eat your protein,
Right.
right? You need to have your protein in.
Mm-hmm,
And, I was reading just last week or earlier this week, that a lot of people think that, proteins, you can't do without animal flesh because, and that was a long time thought that,
mm-hmm,
you know, for you to have all the necessary protein and amino acids, all that, you have to have animal products. But research has shown now that all the proteins you can get, all the amino acids you need,
mm-hmm.
you can get them from plant products,
That's
right?
right.
Plant-based products. So
Mm-hmm.
that's good news. Good
It
news to
is.
me.
It is.
Um, what else should which would I like to tell them? Okay, the ratio of
Mm,
protein and your vegetables, your protein, your carb,
right.
the ratio is very important,
Right.
right? Um,
because
Also, what I
eating
found of
complex carbohydrates is good, but
right,
but
right,
and you've been doing that, really well. You're not eating
right,
those refined
right. The cakes
carbs
and the
before,
yeah, the
so that's
cakes and
good.
the sugars and
But I
you
think
know,
because you're, sometimes people may say that, a strict diabetic or a brittle diabetic, or, when you've had diabetes for a long time, it's sometimes
hmm
harder to
yeah,
effect change in your blood sugar
right,
and your
right,
hemoglobin.
right.
So you may have to do several more things than someone who was just diagnosed
Just
with it.
diagnosed, right,
Yeah.
right,
So in your plate of food, you can eat a lot of complex carbohydrates, which is enough for some people, but it seems like you also need to
be
make sure
careful.
you counterbalance the amount of carbs you eat
Okay,
with protein and
proteins,
vegetables.
right,
You need
right.
to increase the proportion of
Of the veg and the
and the
protein,
protein compared
right,
to the amount of carbs you eat in
right,
one meal, to also offset the spike of blood sugars you may
right,
get,
right. Yeah,
because
that's
it's all
important.
about insulin resistance.
Right.
And you have insulin resistance, so we have to help the insulin along
Yes,
best
yes.
we can.
Okay.
Yeah,
Right, right.
yeah, yeah.
Well, but Doc, one thing that I found out that was interesting. Well, for me, my emotional state of being
Mm,
also affected the level of my sugar.
mm-hmm.
This is not scientific. I didn't do any scientific research on this, but I found looking at my chart.
Right.
If I'm disturbed or something happens,
Mm-hmm.
my blood sugar seems to be going up.
Yes.
And I remember you used to tell me that even playing pickleball because I get aggressive when I'm playing it.
Yeah. And you didn't
And
believe it.
you're right. And I had a problem believing that in the mornings, that why is my sugar going up when I'm
Mm-hmm.
not eating anything? But
Mm-hmm.
I realized that your emotional state of being
Mm-hmm.
does affect your sugar levels. And
Yeah.
maybe you doctors want to
Mm-hmm.
research this
Mm-hmm.
and see if there's any truth in it. That's
Oh,
just
no,
my
no, it's not
hypothesis.
the stress, whatever
The
the stress
stress
may
level,
be,
right, right,
because your stress might be different than my stress, may be different than someone else
right,
as far how you perceive stress.
right.
But whatever may emotionally charge you, create anxiety or depression, whatever uncomfortable feelings,
Right.
um, that can trigger cortisol and epinephrine. It's a hormonal thing again, and then your blood sugars go up, and
Right.
you have insulin resistance, so the insulin is not working as
Mm-hmm.
effectively to bring it back down.
Right.
So
So
yeah, it's really good to be at rest, to be
yes,
calm.
yes, yes. So whatever triggers that off, we need to have that control. Right.
Yeah,
Good,
so I'm
good.
glad you
That's
found that.
important. That's
Yeah, because
important.
I think, sometimes men think, oh, that's not bothering me.
Right,
You know
right,
what I mean?
right.
But
I used to think
yeah,
that too. But
yeah,
when I look at the chart, it does. It does.
yeah.
Right,
Well,
right,
I'm glad you saw that as
right,
well. So
right.
it's been a learning
Yep. It's a
journey,
learning journey.
but you've
And
had successes.
yes, and
I believe you were on a certain amount of medications and you
mhm.
got off two. Do you remember the
Right,
two you
right.
were able to get off?
Yes, Jordan, the one is called. I haven't done Jordan for the last 3 weeks,
Right.
and now glipizide, which I
Hmm.
thought I couldn't do without.
Uh-huh.
No, I haven't done glipizide for a week. What I cut,
Or maybe
we cut out.
two.
We have maybe 2 weeks. The
Mm-hmm.
first week we cut off just the afternoon one,
Right.
and then now we are cutting out both of them,
Right.
which is
Right.
good.
4 to 6. It hasn't been a full 6 weeks because when we
Right,
started, you were
right. You
traveling,
traveled the first
so
week,
we
and
weren't able to do the proper diet then. But given everything for 5 weeks,
yeah, it's about
there's
5 6 weeks
been
we have
a
been on
number
it.
of successes
Right.
we have seen. We will be continuing to work on this
Yes,
program
Doc. Yes, we
to
will.
do some things like your intermittently fasting, which I think is helping.
Well, yeah, that one thing I should
Uh-huh.
mention too. That works a
Mm-hmm.
lot. That's good.
Yeah.
Intermittent fasting. Yes.
You're right. And we just started that a couple weeks
Two
ago,
weeks
right?
ago. Yeah, 2 weeks
So
ago.
we haven't seen the full extent of that.
Right.
Really, you need a full 90 days to really kind of see the full effect
Yes.
on your hemoglobin A1C with all the
Right.
changes and all of them being consistent. And we've been doing it about 80% of the time,
Right. Right.
in
Right.
certain ways.
Yes.
So there's room for improvement both in what you do
Hmm.
and the results that you can get.
Right.
So,
But guess what?
yeah.
I am glad I started. I'm glad I'm on it
Mm-hmm.
because like I said earlier on, I feel better in my body. I
Oh,
feel
praise
more
God.
energetic. I always been energetic to extent, but better and more energetic.
Uh-huh.
I do more activities and not wanting to sleep.
Okay.
Right?
Okay.
And oh,
That sounds
talk
like some
about sleeping,
strength,
doc.
maybe.
One thing we're forgetting.
Oh.
And I would like to tell all diabetics to try this because I never knew the power of this thing.
Oh.
Walking after
Oh,
your meals.
yeah. That's right.
That is my best. I
Mm-hmm.
think that's one of the greatest developments I've had.
Mm-hmm.
And because after meals, I would just, ooh, what a sleep. I was just
Mm-hmm.
sleeping.
Mm-hmm.
But now, when I get my walk, I walk, well, probably I do a little more than recommended, but you can do 20 minutes, half an hour walk. You don't have to be, a whole
Right.
lot of
Just
hard walk,
mm,
just nice, normal walk.
right.
And it is so wonderful for digestion.
Mm-hmm.
I come back and I don't want to sleep. I just go straight. I do something, productive. So
Mm-hmm.
walking after each meal, I would
Mm-hmm.
recommend that to anybody. I
Yeah.
think that works a lot.
Yeah. Yeah. It
And
helps.
even the
Mm-hmm.
sugar levels seems to be controlled much better
Right.
when you walk after meals. And
Right.
I know yesterday, I, I was at an appointment, so I didn't walk after breakfast, right? And I realized the sugar went up more.
Mm-hmm.
So
Mm-hmm.
I think that is very important, to remember
Mm-hmm.
walking after meals. That helps a lot. For
Yeah.
me
Yeah.
personally, that's one of the things that helped me a lot.
Yeah, and you were able to see it in real time. We
Right,
we looked
right,
at your
right.
phone and we were able to see the sensing
Yeah,
and see that how it would go up and down,
right. Yeah,
or
because I'm
be
watching the
steady, more
graphs. Yeah,
steady.
right,
Yeah, so
right.
you could see it in real time that the walking really did help.
It does help. It does help.
Yeah, yeah. Wonderful,
Yes.
wonderful.
I want to say thank you, Doc. You did a good job. I'm not the best patient. I tend to ask a lot of questions because that's how I learn, really.
That's no
I learn
problem.
by questioning. And, well, you've been patient and you have been very considerate. So I want to say I appreciate all you've done and all you're doing. And I'm going to make you proud. I'm
Ah,
going to make you proud.
I
Thank
appreciate that. I'm
you.
glad that you appreciate my
Yes.
efforts. I really tried hard. It wasn't
And it's
always
not
easy
easy,
for
right?
either one of us,
I
but
know.
I'm really, really, really happy that we both can see that you've had improvement
Right,
in
right.
your diabetes control in the last few weeks. It's clear, and I think you can continue to improve
Yes,
when you
yes, yes.
stay on the diet and the whole program longer. It's only been 6 weeks and you've had diabetes for over 15
Right,
years. And
right, right,
progress takes time, and the most important thing is consistency. Keep
right.
doing
Yeah.
what you're doing that you know to do now, and keep adhering to the program, and God will do the rest.
Right. Talk about God. I want to thank Almighty God for His guiding mercies and
Mm-hmm.
for, because sometimes it's like as we mentioned earlier on, it's not the easiest thing sometimes. And
Mm-hmm.
by the grace of God, we are here
Yeah.
and it's only going to be better.
Yeah.
Yeah.
So
Thank God.
I'm proud of you. I know some people in my history as far as patients and friends that did not take this seriously, you
Right.
know, and some of them are not here today because
Yes,
of that.
yes.
So it's a real problem. It should not be belittled. It needs to be taken seriously, and thank God that there's information out there that we can do something about it if we want to. So I'm proud of you that you're doing it.
Thank you.
And I
Appreciate
thank the
that.
Lord that
Yes.
you've had success.
And thank God. Yeah. Thank you too.
All right.
All right.
Bye.
Bye.